A kidney tumor is often found by chance on a routine scan, and surgery is usually the next step. Kidney cancer surgery, called nephrectomy, removes the tumor from the kidney. It's the main treatment for cancer that hasn't spread. Kidney cancer often responds poorly to chemotherapy or radiation, so removing the tumor directly gives the best chance of control. Surgeons choose between two operations. Partial nephrectomy removes only the tumor, while radical nephrectomy removes the whole kidney. For small tumors, doctors often prefer partial nephrectomy because keeping kidney tissue supports long-term kidney and heart health. Surgeons use three approaches: open surgery through one larger cut, laparoscopic keyhole surgery, or robotic surgery with precision instruments. Under general anesthesia, the surgeon reaches the kidney, controls the blood vessels, and carefully removes the tumor or whole kidney. Removed tissue goes to a pathologist who checks the type of cancer and whether the edges are clear. Hospital stay is usually 2 to 3 days after keyhole or robotic surgery and 4 to 7 days after open surgery. Recovery is gradual. Most people walk within a day, return to light activity in weeks, and feel close to normal by 3 months. Every surgery carries risk: bleeding, infection, blood clots, urine leak, and some reduction in kidney function are the main ones. One healthy kidney usually does the work of two. Staying hydrated and monitoring blood pressure protects long-term kidney health. Follow-up scans and blood tests continue for years afterward because most recurrences happen in the first few years. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.